Hello, my name is George Tasca, and I'm a professor in the School of Psychology at the University of Ottawa, and this is a brief introduction to psychodynamic therapy. There's a good evidence base for psychodynamic therapies. There are about 256 randomized controlled trials that you can access on this website that's hosted by a Danish researcher. And there are a number of systematic reviews and meta-analyses. So I'll focus on the one by Leichenring in 2015, which is a fairly large one, that basically found that psychodynamic therapy was superior to waitlist controls and to treatment as usual for a number of disorders: depression, anxiety disorders, panic in particular, eating disorders, and personality disorders. Psychodynamic therapy plus medications was more effective than medication alone, and the outcomes in head-to-head trials with other treatments like CBT indicate equivalent outcomes. There's also good evidence for longer-term psychodynamic therapy for chronic disorders or people with multiple comorbidities or with complex trauma. I'll cover a few basic topics related to psychodynamics, and one of them has to do with the unconscious mental life. This is the notion that there are important memories or perceptions or judgments, affects, motivational processes that are not always in conscious awareness or consciously available to the individual. In other words, there's some things we just don't know about ourselves and sometimes don't want to know about ourselves. We often see patients, for example, who say that they can't understand why they did something, or can't understand why they continue to get involved in certain types of relationships, or I don't know why this keeps happening to me. That kind of thing is very common for patients to say. And oftentimes the motivations behind these kinds of behaviors or thoughts or feelings are not really available to them, but yet it's causing them a lot of grief. And so therapy might involve making these unconscious motivations more conscious for the individual so that there's a little bit more control over them. There might also be a focus on internal conflicts, and people have complex and often contradictory feelings and motives in their lives. They might have conflicting feelings about attachment needs or adaptive feelings. For example, it's not uncommon for patients to have a sense of an initial sense of pride and then a lot of shame related to that pride, often based on a history of being diminished or denigrated for having prideful feelings. And that's just one example, but you can also, see a number of patients who might have conflicting feelings about important attachment figures, both anger and love for a parent, for example. And so this ambivalence is often unconscious as well, and often has an impact on how people experience themselves, their relationships, and their feelings. And so making these internal conflicts more conscious, or also helping to reconcile these conflicts, might be a goal of psychodynamic therapy as well. The concepts of self or relationships is also important, and really the key thing here has to do with development. The idea that earliest experiences lead to these internal working models of relationships, or of how the world works or how the self works. And the idea that personality is shaped by this history of internalized relationships, that we take in these important attachment relationships, make them part of ourselves, and that has an impact on how we function, how we manage and cope, for example, how we relate to other people, how we relate to ourselves. And sometimes these internal representations of self and others are not always consciously available. And so therapy might involve helping people to understand the role of attachment in shaping their lives, and as a way of trying to help them change their current relationship patterns, their expectations of others in relationships, and their views about themselves. I've alluded already to defense mechanisms previously, but basically defense mechanisms are a tendency to avoid, deny, disavow, minimize, or distort something that's dissonant within the self. And so defense mechanisms are important. They allow people to maintain a certain psychological equilibrium, but they can also be maladaptive. And they also tend to be outside of awareness. People aren't always aware of how they manage and cope with internal conflict or with negative feelings. Defense mechanisms can be more mature, like altruism or self-reflection, or they can be more immature or maladaptive, like denial, acting out, projection. And typically, the more problematic one's attachment history, the more maladaptive one's defense mechanisms are. And so, a goal of therapy might be to help make these defenses, particularly the more maladaptive ones, more adaptive, or help people sort of shape them or change them into more adaptive means of coping with internal conflict. Another key concept is transference. The transference really involves applying previously formed templates or schemas of relationships, perceptions, onto a new person. So again, these are often affected by attachment histories, these expectations of new people, and we might have these expectations and apply them inappropriately, perhaps to a new context or a new person. So, for example, sometimes you might see a patient who believes that everybody's out to get them, or that other people are often capable of, or typically will use them or mistreat them, even though the other person doesn't necessarily have that motivation, like a therapist. And yet that kind of distortion and distorted view of current relationships by projection or displacement or some other defense mechanism really has an impact on the person's capacity to have a meaningful relationship with another person, including a therapist. And so a goal of therapy might be an opportunity for the therapist and patient to understand these patterns, these perceptions of others, and use the therapeutic relationship to change these transferences. So the key aspects of or features of short-term dynamic therapy might be a focus on affect, right? Experiencing and expressing emotions, including those conflicting emotions that I talked about earlier. Exploring a patient's attempt to avoid topics or avoid things through defense mechanisms. That might mean helping patients to uncover or talk about meaningful events and the impact of those events on themselves, on therapy, and on their relationships. And this might mean exploring things like defense mechanisms and the impact that some of the more maladaptive defense mechanisms have on the person's life, on their view of themselves, and on their relationships, including their relationship with the therapist. A third key feature is identifying patterns in feelings, thoughts, self-concept, and relationships to try to make these more conscious or more available to the person. And so a therapist might use things like interpretations to link these feelings, thoughts, and behaviors and self-concepts and patterns together so that the person has a better understanding of themselves and why they do things. That's the whole idea of making things more conscious or more consciously available. There's also a tendency to focus on past experiences. Again, if our lives are not only punctuated by, but shaped by our attachment histories, our views, including our views of ourselves and our views of current relationships, then it's important to know what they were, how they had an impact on our current relationships, on ourselves, and on our symptoms. And so part of that involves helping the patient develop a coherent narrative of their lives and the role of their symptoms in that coherent narrative. There's a focus on interpersonal experiences. Oftentimes, people come to therapy because they're having problems in their social supports, in their close relationships, and these problems really get in the way of individuals being able to have fulfilling lives and to meet some attachment needs. And so identifying these interpersonal patterns that are repeated over time in settings and people are really important to help people to then start making some shifts in those patterns. And one of the ways of making those shifts is really to focus on the therapeutic relationship, including the issues around transference. And so the therapeutic relationship is not only a vehicle, not only a context for change, but it's actually the vehicle for change. Examining the relationship and trying to use the therapeutic relationship as a means of helping the person be different and to experience themselves differently and experience other people differently is a key part of dynamic therapy. So that's a pretty quick and thumbnail sketch of dynamic therapy. Here's a few references that might be useful to you. I suppose if you're going to start somewhere, I would start with Shedler's paper. It's freely available online. It's an unpublished paper, but it's a nice description of dynamic therapy. Thank you.